Now, the next thing is physicians, okay, should be very much open-minded. This is a simple example of autistic child. She came with the parents from Shanghai, and we treated them, and then and there was a lot of improvements, because we always tell the patient, parents, if you don't see any improvement, please don't come back. If you see improvement, please, you can have an option to come back, okay? So we always make in such a way that they make the decision, no results, please don't come back. So again, with burns, we have been treating a lot of burns. We can do very well on the burns. You don't need the stem cells. The peptides will be good enough. Okay, you can use the skin placenta and even the mesenchyme, to build the connective tissues. Gout, this is a situation is coming from my own staff, He was more time on leave, medical leave, than coming to the office. So one day I asked him what is happening to him. He's only 34 years old and he cannot even walk. He's on wheelchair. So he was a very loyal old staff of more than 10 years, So he told me he has been in the hospital in and out every day, almost every day, okay? In and out for his gout problem, okay? He used to drink. He's only 34 years old, okay? He drank and then the wound don't heal at all, whatever treatment he done. So I told my medical team, my aesthetic doctor, just spray the placenta and skin, NOP over it, spray before you inject around the wound area, not on the wound directly. And it went off so fast. He recovered totally and he can walk now and work as a normal person. Okay, so there is a lot of good solution where you don't have to be very invasive. Now, some of you probably has watched this video. This video generates 77,000 audience. 77,000 audience, because this is a kidney patient. His name is Dr. Michael McGuinness. He's a doctor in USA. And I was introduced to him by Dr. Jurina Spida, the wife. Okay, the wife was the one in the middle with the dark glasses. McGuinness is behind. He was in the jungle doing trekking in 219 in Slovakia, and they went to Iceland too. Now you look at the left. He was having a stroke in the plane. Okay, he ran the medical center and having a stroke in the plane in USA. So upon out of the plane, they rush him up in ICU, go to the ICU and try to save his heart. In the process of doing the heart open surgery, they damaged the kidney too. So in other words, he was on kidney dialysis 3 times a week, apart from a poor heart. So double jeopardy instead of one. So when we were introduced to him, when we gave a lecture in one of the conferences in Las Vegas, the wife came to see us after attending our lecture of 20 minutes of Dr. D and mine. He came in and said, my husband is up in the hotel. He took hours and in between stopped to reach us. Okay, he came to look at all the seminars on stem cells. It was a lecture on a lot on stem cells. We are one of the presenters. And she said, my husband has tried all kinds of stem cell in the USA. All kinds and all the reputable centers across the world. I have been there and spent the money there. Okay. We are out of retirement now. We are on retirement now. We sold away the business. We have the money, but we have to take care with the money for his condition. He cannot even walk and come down to see us. When he talks, we cannot even hear his voice. Okay? And he is already 6 to 8 months on dialysis when he meets us. So when he asks us, I want the stem cell for my husband, I do not mind going to Europe or Asia for the treatment. You know, on our side, we are not so confident. Okay, we are not so confident at all. Dr. D and I wasn't so confident because he's already 6 to 8 months on dialysis. Okay, and he was so weak that he cannot even drive. He cannot go on a plane anymore. And even in between driving, he had to stop for many times to reach a destination. So the only thing I can give, and not to discourage them, you know, and telling very frankly, I am not that confident to treat. I mean, we are not so confident to treat, is you take 3 sets to 4 sets of the MO, the mitral organelles, the stem cell peptides of the heart and the kidney. Since you are a doctor, you buy at the doctor's price, and these are the materials you have. We have the heart, we don't have the kidney. So we give him the heart 4 sets, we sell it to him 4 sets. It doesn't cost a lot of money for a doctor at that time. Okay, it is still not expensive at this moment, especially even to most of the doctors who are buying it, you know. And 1 month later, when we went back and we shipped to him, it was already 1 month when we shipped the kidney. We shipped the kidney. Okay, so he did inject the kidney. Our wife inject on him. And 4 months later, he gave us a call and he said he don't understand. The cardiologist in Stanford Hospital and another nephrologist say he don't need dialysis anymore. So 2 expert hospital, the specialists tell of different 2 good conditions. One is the heart and the other one is the kidney. So he didn't go on dialysis anymore. And at that instant, they asked, can I come from the stem cells now? Because I want to revitalize Michael. Okay, they came and we treated him. And he improved so much, you know. So in the video was given by them. We didn't ask it or we paid any monetary. We never had monetary conditions for videos. It's up to the clients they want. So he said, I want to tell to the world. So he came to thank us all the way from USA. He flew down from Ecuador because he retired in Ecuador. Okay, he ran an operation in USA. Flew down from Ecuador, flying to Florida, and flew down 30 over hours to reach Kota Kinabalu to say thank you. Okay, I say you don't have to do that. Okay, no, he said I came here is because I still want to attend your team lecture of 2 days on all the different lectures. He attended full 2 days, and the 3rd day was also on product. It means 3 full days he attended, from morning until evening. Full time he attended with the wife. Together with doctors across the world, including the Japanese doctor, including doctors from Belgium. All over the world, the doctors came down. There was also a number of American doctors. They came down to Kota Kinabalu, and we give the lectures on different topics with our speakers. We have around 8 medical doctors, 7 medical doctors. They all present, okay? And during the lecture, he went up and he rushed up and said, I want to say something to your doctors here, including some American doctors. And telling himself as an American, he wanted to say this out, although most of the time Americans will not tell their story like this. He said his condition, and that condition, he insisted we have to record it. So that's how we record it. He went on to our Bangkok clinic, you know, for another lecture after that, and he also recorded the one in Bangkok. So we have 2 videos there. Okay, it's on YouTube. Okay, and he generated, I think, 77,000, and there was another one with almost 1,000 or 2,000. Okay, so the same video. Okay, now a lot of people in the Facebook asked us, what happened to Michael? Is he dead? A lot of people asked me, you know, I didn't really answer. So 3 days ago, Michael called me coincidentally. You know, Michael bought a land of acres of land and built a villa. He's building hotel resort villa together with the wife out of retirement to invest back into the business. So that's surprising. I thought they were going to retire for good. No, he said, no, I'm in top health. I want to do back business. So he bought a villa and he's going to build a European wellness center there in collaboration with us. Okay. Now, the good part is the question is everyone was asking, what happened to Michael? So if you look at the second question on your right, that is when he is in Europe and Asia. He took the video. While he is undergoing youth restoration and revitalization program. That means the DDRR. You cannot just do the stem cell for regeneration. We should be a proper diagnosis, conventional diagnosis and biological diagnosis. Then we move to detox. We have the detox, everything in the body we can, okay? Even the lipids, okay? And then we move to repair. We have a number of biological treatments for repair, including infusions or equipments. Then only we do the stem cells. This is the right way. I know a lot of doctors in Asia, they will do a fast one, just inject the stem cells and that's it. That means you didn't detox everything out and do a proper repair. The body is not in the best optimum condition to get the regeneration. So if someone were to say, if I were to inject this without the DDRR, what is the result? That means instead of DDR, you only have R at the back, regeneration. I would say the result is 65%, 60 to 65. If you do the proper detox, everything, go with the right channel, you need 3 full days at least to do that, or 4 days. Okay, 3 to 4 days, like what we are doing all over the world, even in Asia. The result is wonderfully well. It will always be 90% results. Okay, so move on to 24th of August. Look at 24th of August 2019. It was jungle trekking. Okay, the earlier figure was 2018, a year ago. Okay, see the difference. Move on to September 2020. He is enjoying beer in USA in the resort. He's traveling across the world. It's important. He's enjoying life. And on 2021, when he called me, he sent me this. No, when a few days he called me, but he sent me one of the photo on 2021. I asked him, I told him why I need your photo is because some people thought he's dead. He's no longer around. So I say, you better send a photo, and he sent this photo. Okay. So I have to say, from stage 5 to stage 3 kidney failure, not everyone will believe what we do. Okay. But he went through the miracle of stage 5 and 3. That means he's disciplined. He was disciplined, and he's continuing still the vital organelles of the kidney and heart with us because he wants to be fitter and fitter. Okay, so he's still continuing. That means he did the stem cells, he did the MO, but he's continuing regularly. Okay, you don't have to do it all the time, but regularly you keep on contact, keep in constant. Because remember, I say you have a fixed kidney cells. So we repair the dying kidney cells to maintain that amount of kidney cells. We want to extend that cell's life. Because after some time you age, you will still come down. So we do not want the deterioration to go so fast. So this is not the first CKD patient we did, but this was one where you have a doctor who is treated by us and he's a patient. And we become partners in the business. Okay. So the next one we have was, I do have a picture of this boy when he was a very big size. He was introduced by an American doctor. After a presentation in one of the Stem Cell Association, Academy of Stem Cell Physician, one of the American doctor approached us. He said, "You have this VIP patient. The son is an autistic son, and he had problems. He's a European. He's from Romania, but the father is a good businessman, a rich businessman in a way. But he don't find solution for his son. It was very difficult to control his son. His son was probably 2 times the size now of the blue size, and 3 times, maybe 2.5 times the size of the one on the white. This is a recent photo the father sent to me 2 weeks ago when I asked for the photo for this presentation. Okay, so when he was treated, he was 20 years old. He was very tall and big size. Okay, the way he eat is so huge. Okay, and it has to be A to Z. It has to go in that manner. You cannot have A, H, Y. No, it has to be A, B, C, D in this manner he eat. And the time must be that time. It's a very uncompromising regime he's going through. So to treat patient like this, it's not just to give him the stem cells now, because his attitude is also different. So I always think that you have to treat a patient with a heart means you have to go to his world. And that's what I did, to go to his world, because he's not going to see any doctors at the same time. So to make the patient like you, you have to go to his world. And I make in such a way that he himself insists I must be there for him when he's injected. And he is still coming back to Asia. He bought a ticket the last few months to come back to be treated. But unfortunately, we have to go with the quarantine of 14 to 21 days. All the tickets are bought. We have so many patients for already bought ticket from USA waiting to come to Asia. Just waiting to come. Their ticket has been bought, and it's one of them together with the parents. So I will get a picture of this of a before. I do have some picture of him of before. It's just a last minute I couldn't track it out, because last minute I asked my people this morning to include this picture. But he's not the only autistic children we have. We have so many of them. Okay. The important thing is we give the right stuff, and of course, one of them is GCMAF. The GCMAF we are the first people who introduced GCMAF to the world, although it is invented by Japanese. We started the first to introduce to the world in 2010 for cancer patients and preventive of cancers. The good part about GCMAF is not from the blood serum. We're the first one in the world, and it's not coming from blood serum. So we don't have so much problem with the regulatory side when it's not from the blood serum. So we go with peptides, and these are some of the things. Of course, there are also something done in the clinic. We did use ozone on him. We use heart chamber hyperbaric. We use some biohormonal devices in Germany. We have the Russia, some kind of Tesla technology, plasma, So there's so many other technology we did all over, okay? And he has wonderful results. But there are so many of them. I'm just giving you some of them here, okay? I cannot be saying so, otherwise the lecture will be very long. Now, this is a Parkinson patient. For 20 years, he had Parkinson. He can't walk and unable to take care of himself. 2 to 3 guys had to hold him and take care of him for life. He can't walk, remember? He can't take care of himself. After 4 months of treatment, he can walk by himself and stand and sing. The tremors is very little after that. And the stiffness is so no longer there. He still take the dopamine, but it was totally reduced to a very low level. Okay? Because there's no cure in Parkinson. You have to understand that. There's no cure. But if we can reduce the intake of dopamine, because the dopamine intake will continue to increase until a certain time it won't work, and then the patient will not be around after some time. Okay, so what we did with the Parkinson patient in our experience was we cut the intake of Parkinson patients by 70% over the 6 months. So we cannot give a sudden total withdrawal. We cut by 20-30% and slowly reduce until 70%. And that's what we did with a number of Parkinson patients. And the Parkinson patient continue with the NOP of the CNS oral, or on and off. He can even inject on himself the MO. And the good part about this guy is 2 years ago, every year he will come to KK. He will stay 1 month in KK. He stay in a suite room in KK, the best suite room of a 5-star hotel, for 1 or 2 months with his 2 helpers. But instead of him taking care of the helper now, instead of the helper taking care of him for many years, he is taking care of the 2 aging helpers who age more than him now, who are younger than him. And he is taking care of him because they have been taking care of him very well. And he played tennis, and he played badminton. He played all kinds of things now. He sing all the time. So you can imagine what I'm trying to tell you is the quality life here. You can say he never expect to have the quality life before. Okay, he has all the money in the world, but you don't have a quality life. We treated him so well to the extent he improved so well. So that is what I'm trying to say. There is a solution for everything, but you have to know of the right cells or peptides to be given. You give the wrong one, you will never have the results. Then the reputation will be affected for the doctors. So I will always say, if you don't have confidence to treat the patient, don't treat the patient. Okay, because you don't have the confidence and the result is not there, so we better don't treat. We don't want to run into problems of people complaining that we took the money and we don't see the result. So this is another simple case. This is a doctorate student. He's already a doctorate now, okay? And he's a boyfriend of one of our staff. You know, he cannot even wear a shirt. The moment the shirt touches his body, he will have all the pain and you have pus and blisters and things. You know, it's a very chronic disease. But I have treated people more chronic than this. Actually, I've treated people much, much more chronic than this. It's all over the body. That means a Chinese boy become an Indian boy without eyebrow. You can imagine how serious it is. But with this, we make a very simple situation. We use the ASI therapy. We treat it by a way of an autologous vaccine taken from his Buffy coat. And the Buffy coat is the DNA of the immune system. We combine it together with our stem cell peptides, the super transfer factors, and plus other things, the timers. It works so well for him, and this is only the second treatment. You know, it's supposed to come for 3 treatments over a period of 3 years. Okay, but over a period of 1 year, and that is the results. Even without a few months, we see a lot of result because it is even much better now. I'm trying to collect the picture. We should have a better picture of what we have now because this is also an old picture. So this is MS, autoimmune. If you were to tell me for autoimmune disease, what is the best treatment? Is stem cell the best solution for autoimmune? I will not say so. I will say you have to use the stem cell together with some other autoimmune therapy to get the best result. You cannot rely only on stem cells for the autoimmune. This is my personal experience, okay, and the experience of all the doctors in our clinic, okay. So again, the face is the brain of a person. The IQ of the face of a person is always in the brain. So when we treat the autistic children, our pediatric doctors, the first thing is we want a video shot of a small clips of the children of the child. Okay, we look into that. Okay, so this child on the left one was in Europe and she was treated. She's a Down syndrome children. By the age of 10, you notice her face is so different. She don't look like a Down syndrome child. Okay, the face has changed so much. The IQ has improved, so the face will change. So look at the boy who started very late at 9.5 years. Again, by 10.5 years, 1 year later, there was a lot of changes. We only give the stem cells and peptides of the brain. Nothing else was given. So again, this is a charge syndrome. The boy can't lift up the head, he can't stand, and he can't see. And if you look at the later part in the right-hand picture, he's already with spectacle and standing. That means he can see already. Okay, although the glasses are very thick. Okay, but he can see and he's walking on his own. He went on a tour out of the country. He's from Hong Kong. He have done 8 treatments, 8 treatments. And all the 8 treatments are sponsored. The first one was sponsored by all the Hong Kong Doctors Association because they don't have money. Okay, they're in very poor living conditions. Okay, the second to the 8 treatments was sponsored by a foundation. Okay, and the people who contributed to the foundation was actually my wife and I. We paid the money to treat him. And when we treat him, we send the whole family down, fly them down, pay the air ticket of everyone and pay the hotel and pay for everything. And we treated him. Never for the money. Because we see a solution for this charge syndrome where in medicine, conventional medicine, there's no cure. It's a very difficult condition. Okay. The eye specialist didn't believe he can see. But in the later part, he has to admit he is seeing because he's already wearing his spectacles. So there is a lot of condition for everything. The important thing is with the right prescription and protocols being given, we will get a good result. Now, you can always contact the people or the managers who are with you. But if you need some technical information, I'm always there for you. You can always WhatsApp me, you know, or send me an email. But WhatsApp is the fastest way to reach us, you know, and I'm always there for everyone. I work 14 to 16 hours a day, every day. I spend a quality time with my children. I have 3 children. My eldest is 25, okay? And my younger one is 21, okay? So I carry on the life. I love what I'm doing very much. I'm still going through a lot of research, moving a lot with US FDA. And also we have a lot of studies ongoing with safety and toxicity study and drug study with Heidelberg University. We are sponsoring all these studies in millions and millions. So I sincerely think we have to move into research to push us all into the next level and share the results to everyone. We must treat with a heart and a passion.